gentlemen, you are welcome to the day 4 of this very, very special program. It has taken a life of its own since we started on Monday. And like I was telling dear Prof here, our cause is just. And the purpose for which we have set up this program is noble. And we could say from the participation that we have been getting. We should have started by 10 a.m. exact, but for the number of people in the house, right now we're about 29, and I know others will join us. But we cannot keep those who come in early waiting. I punish them for being nice and for coming early. So we start, and they will join us. So please, let's rise for the national anthem. Thank you. Please, you can have your seat. Yes. Yes, they say we pray a lot in Nigeria. And like I said yesterday, we are not ashamed of that. So let me call on Sir Ike Onyeche to please give us a word of prayer to start.
Shall we pray? Our everlasting Father in heaven, we thank you for making this day possible for us. We thank you for life. Thank you for our country, Nigeria, a vast and gifted land you've given to us. We thank you for our leaders. Thank you for pharmacy. Thank you for the media. Thank you for the medical and healthcare professions. We're gathering today, Father, to expound the possibilities and areas of further enhancement of our healthcare delivery. So we thank you for making this gathering possible. We pray that the purpose for which we gather today will be realized at the end of the day, and all glory will be given to God, and as your children will be beneficiaries. Thank you for we pray in Jesus' name. Amen.
Thank you very much. For those of us who know Sir Yechi very well, I'm sure before Alpha is prayer, and after Alpha is prayer. Even during Alpha is prayer. That is what we know him for. And he has dispensed that blessing for us today in adequate dose. We thank you very much, Sir Yechi. When we spoke yesterday, I said we need you at the studio, and here he appears. Thank you so much, sir. We thank God for the people that are in the house already. We have 32 already in the house, and I could see so many of our distinguished people. Professor Isamate Saini was one of the first people to appear today. He's going to be the chairman of today, so wonderful that we have you in our midst. Dr. Mohamed M. Zango, the first pharmacist, managing director of NMPC Medical Services, is around. Professor Ike Uzochukwu has been a constant star in here. I've seen you and many other people in the house. The studio today is rich, very, very rich, as we have the leaders of Nigeria Academy of Pharmacy and leader of Nigerian Guild of Editors, who are the partners involved in this program. We also have one of our resource persons, Mrs. Biageri Iku, in the house. You are welcome. It's difficult to describe this, our auntie, because we just celebrated our 70th, and when I saw her this morning, I said, Auntie, are you sure it's not fake news? It's not, or you didn't give us fake age? For those of you who know her very well. Well, you get to hear more from her, so you can judge for yourself whether I'm right or wrong. Ma'am, you are welcome. Again, Sir Yechi, I thank you because you have a choice to be in the comfort of your office, but you chose to be here with us. We thank you for that. Yes, when Sir Tueyi saw him this morning, he said the man they couldn't arrest, that we have been looking for him. And that's the president of the Nigerian Guild of Editors. And he came here so early in the morning. Thank you so much. We know that it's the cause of duty that has prevented you from being around, because you work hard for this, and you even facilitated it, because on first call, you just said, yes, let's have it, and that is good. So, Ifeanyi Atueyi has been a constant star, just like I've told you yesterday, sir. Thank you very much, sir. But I came here before you again. So you have 2 more days. you have 2 more days to you have 2 more days to meet me. He said he threw the challenge himself. He said he wants to be here before me. So you have 2 more days to do it, sir. And we have our father in the house, Prince Julius Adewale Adelusi Adeloye. Since Monday, he has not failed to be here. Thank you very much, sir. We appreciate you. We go straight. I have a message for you, but I would prefer that we have more people in the house before that message is delivered. But we go straight to our program of the day, and it is my pleasure to call on the president of Nigerian Guild of Editors and the principal partner in this program, Mr. Issa Mustafa, to address us. Mr. Mustafa, please.
Thank you so much. Since the program commenced on Monday, I wasn't in Lagos. I was toward the east, but yesterday I got a flight from Asaba to Lagos. But I said, no, I have to be here today. I said, to hell with the flight. I just hit the road to make sure I'm here today. And I thank God that I'm here. President of the Nigerian Academy of Pharmacy, former Minister of Health, Prince Julius Adelusi Adeloye. Sir, how many of you have been ministers? I mean, pharmacists have been ministers of health in this country? Very few of them, very few. Sir. Professor Mbag Femi Oyewo of Alabama Sanabazon University, Agoye, who is the resource person today. He's also the chairman of Board of Fellows, PSN, and also a fellow of Nigeria Academy of Pharmacy. Mr. Ike Oyechi, of CEO of Alpha Pharmacy, treasurer of NAPHARM. Sir Ifeanyi Atueyi will be with us for before the beginning of this program. The VP, NAPHARM, and publisher of Former News. Mrs. Obiageli Iku is the resource person of today, is a moderator. Chairman of the day, Professor Issa Mate Husseini. And I don't know how to introduce you, sir. Doug, you have been with us planning this program. We'll be there like the Northern Star, constant. So I'm happy that, yes, and it's clear for us. Honestly, it's been so wonderful working with you, sir. It'll be so, honestly, be so resourceful. I don't know what to say. I'm happy that I'm here today. For the past 3 days, this is the 4th day, things have gone well for us, and I'm so happy that this partnership was well conceived and is going on as planned. Some of you may be wondering, why this partnership between Nigeria Guild of Editors and the Nigerian Academy of Science? The reason is simple. When a nation is in trouble, professionals like us, who don't have a place to do our business. When the nation was shut down because of COVID, did you go to work? Nobody went to work. So that is why anything that can be done to address this COVID-19 pandemic, the Guild will be there to lend support. That's how we are doing it. COVID-19 pandemic has affected all sectors of the economy, including the media. So anything that can be done to conquer this pandemic, we have the support of the media. The theme for this one-week conference is facts, myths, and way forward. As journalists, you know that we deal with facts. We always say that facts are sacred, but comments are free. That is how you see pastors who are not professionals talking about vaccine. They are comments, but it is free. So there had to be lots of myths. You have lots of myths surrounding the COVID-19 pandemic, conspiracy theories here and there and all that. But it's our duty as media people to separate facts from myths and fictions. To dig out the facts, we talk to experts like you, sir. So that's how this partnership. For the next 6 days, an array of experts will be talking to us this Monday, and more are still going to talk to us. And when experts talk, they make news. On Monday, Dr. Ihekwazu was with us, the DG of NCDC. I was in the when I monitored him, and he spoke eloquently, and it made news. So we are going to talk. NAFDAC, did she eventually come? The DG of NAFDAC? Okay, coming tomorrow. So you're going to have her tomorrow, and she will talk to us. One thing about NAFDAC is this: Professor Adeyeye, when they brought in the AstraZeneca vaccine to Nigeria, they did their own tests and they certified the vaccine to be fit for Nigerians to get it. And she took it herself. People were asking, are you sure this is safe? I said, what are you saying? The person who certified the vaccine safe has taken it herself. So what are we saying? So go ahead and take it. So that is why we are here. I joined the farmer NAPHARM to say that we are partners in progress. And even after this event, I can assure you that we will still go to keep working together for the benefit of Nigeria. So on this note, I welcome all of you to this event. Thank you so much.
Oh, wow. Thank you so much, sir. You see what we have missed since Monday, and I'm sure you are going to be here tomorrow. So I'm committing you already that you are going to be here tomorrow. You will recall that the president of the academy said on Monday that this partnership is fresh, and whatever you have seen now is just the beginning. We are certainly going to do many more going forward. Like I said, I will reserve my message till we have more people in the house. We are 44 now, which is a very good thing to see. May I therefore call on the MD of Alpha Pharmacy, Sir Ike Onyechi, to introduce the chairman of the day. Sir Onyechi, please.
Thank you very much, Dr. Lalu. My job today is to introduce a global scientist, a pharmacist, who is both homegrown and has international reach and international exposure and training. It's homegrown because it's a product of our Ahmad Bello University, Nigeria, primarily or principally. It's also worked in Nigeria in the university system as a researcher and a teacher. He has worked in our own NIPRID as a director and principal research person. I know NIPRID has done a lot of work, especially in herbs. We're talking about myths, we're talking about challenges, we're talking about facts and the way forward in COVID. So we needed to find such a person. He trained here. He trained in Chelsea, in UK, where he got his PhD. He also trained in USA, where he also was a big research person, a recognized research person in West Virginia University. He has a deeper reach than we can talk about here. But I want to reserve the rest of his very wide exposure and reach. And he has done a lot of work and has a lot of awards, global awards and national awards in Nigeria. He's a member of the Nigerian Academy of Science, and he has many other international recognitions and affiliations. He is highly recognized because of his work in cancer, the use of herbs in cancer treatment. We know we have a lot of research products in Nigeria, but his is one of the most outstanding ones in the area of research, for which he has had global recognition. His research in cancer is an area where we want to look at also today. I'm sure by the time he speaks, you will find some more of what he has done in cancer, and how this will be a base for further work and further encouragement for other research scientists in Nigeria. I'm talking about no other person than our professor, who's a member of the Society of Neuroscience, American Association of Cancer Research, and is a member of Pharmacists Council of Nigeria. You can see why I started by appreciating him as both a national giant and a global giant. Join me, ladies and gentlemen, to welcome the chairman of today's occasion. He's a distinguished scientist. He's a pharmacist, more than any other thing. He's a researcher, as a local giant and a global giant, internationally acknowledged and recognized. Join me to welcome Professor Issa Mate Husseini as the chairman of today's event.
And in addition to all that has been said about Professor Issa Mate, he is the current commissioner for Earth in Borno State. Our dear Prof, you have the floor. Please unmute yourself. Good.
Thank you. The president of the Academy, Prince Julius Adelusi Adelui, the vice president, secretary of the Academy, co-host of this important event, the president of Guild of Editor, Mr. Isa Mustafa, invited guests, ladies and gentlemen. It is my pleasure to be part of this important occasion and looking at the caliber of people that will really give justice or do justice to today's topic, drug use and misuse during the pandemic. We are talking of COVID-19 pandemic. So I hope they will dwell on normal use as well as misuse of this. As you are aware, COVID-19 came into being from Wuhan, China in 2019, and it's caused by SARS-CoV-2. At that time, no known cure or treatment, but because of the energy and money invested by different countries and societies, now we have 8 vaccines. And other drugs, orthodox drugs, which were previously used for other drugs, like other diseases, like hydroxyurea and dexamethasone, and they have some beneficial effects in this disease. But as we know, COVID, the pandemic, made societies to be locked down. And once you confine people to a particular space and restrict their movements, a lot of things happen mentally and physically. And in the United States, the use of narcotics, especially the opiates, has really increased during the pandemic. And mental illnesses also have increased. So people have resorted to taking orthodox drugs and some even alcohol. Hopefully, the keynote speaker and other contributors will give us examples of this in Nigeria, because whatever we do, if we look at it nationally or globally, we better bring it home. How relevant is this to our society? So mental health problems and drug abuse, very important. And we have noticed even in Maiduguri, recently I've been appointed to oversee the Ministry of Health, and I am also the Chief of Staff to the Executive Governor of Borno State, His Excellency Professor Babagana Umara Zulum. And what we did in 2020, early 2020, really complete lockdown of Maiduguri and other major cities. And we observed that even the use of trafficking of cannabis and all this thing has increased. And the neuropsychiatry, they have seen some jumps in some mental illnesses, especially depression. So all these things are areas that I think we will dwell on, and then at least come out with a communique or something that will be used as a reference in the future. So with this, I think I will like to invite the keynote speaker or the next person to address this gathering to take over from me. Thank you.
Thank you very much, dear Prof. Thank you very much. You combining those 2 powerful posts of Chief of Staff and that of Ministry of Health, that's a good one. And we're happy that you are here. There are so many questions that we will direct at you as we move on. Our people are highly skeptical about all this. But yesterday, some people call it the old pandemic, the old story. They say it's a medical fraud. And so many other things that was said. But let us face the business of the day. Then we will request that you help us to handle some of the questions. As part of the recognition, I've seen my teacher in the house. I saw him in the morning, but I don't know, he skipped me. That's Professor Undu David Ifudu. Prof, are you around? Professor Ifudu? Oh, wow. Is that No, he can't be out of stock. I saw him before. I can't forget Prof. Very strong and yes. Okay, Chairman Board of Fellow, former Chairman Board of Fellow, Dr. John Waiwu. You are welcome, sir. We have seen you. Thank you for being around. I don't think this is your first time. He has been around too. I think I've seen him a couple of days before. In the house, we have Dr. Soji.
Thank you very much, Dr. I decided to be anonymous.
We can't hear you anymore, sir.
I don't know what's happening. I don't know how it's happening.
Can you please mute Dr. Wewu? Okay. Yeah, Dr. Waga has been a constant star. Thank you so much. I see a classmate of mine there, Dr. Olanik Kainde. You know. Thank you very much. Is Diana in the house? She's supposed to take up the introduction of the keynote speaker. Okay. No. If Diana is not in the house, I take the pleasure of introducing our keynote speaker today. You will permit me that if I were to deal on your profile that I have here, it will take us the whole of the 2 hours that is allocated to this program. So let me just, but since I met him, I've seen a man who represents the future that we desire for this country, particularly in the area of research. And since we got to be working together, there is no assignment that I put to him that he has not accepted with joy. I'm talking of erudite professor of pharmaceutical and medicinal chemistry, Professor Ikemefuna Uzochukwu. Professor Uzochukwu, you are welcome. You have the floor as our keynote address speaker. Thank you.
Good morning. Thank you, Dr. Lolu Ojo, for this opportunity. Let me start by appreciating all persons that are on this platform, starting with the President of Nigeria Academy of Pharmacy, Prince Julie Adelusi Adeluyi, former Minister of Health, the Vice President Saifani Atuenyi, our own daddy, and Director of Projects and Programs, Lolu Ojo, Dr. Lolu Ojo, and then the Nigeria Guild of Editors. The chairman is here, Issa Mustafa, Nigeria Academy of Pharmacy, who are here present, and then colleagues and other professionals here. I thank Nigeria Academy of Pharmacy and Nigeria Guild of Editors for giving me this opportunity to present this topic. The host, I want you to allow me to share my screen.
To share your slide.
I want you to allow me to share my screen.
Done. Just go ahead. Professor Ike, go ahead and share your slide.
Okay.
I think he has some network.
So this is drug use and misuse. Drug use and misuse. Hello? You are seeing my slide?
Not yet. Is it?
Yes. We can hear you and we can see the slide.
We can see it.
COVID-19 pandemic.
We can see it,
Okay.
yes.
Thank you. Thank you. So, I'm of Nnamdi Azikiwe University. So this is the outline. The first thing, and I have an old definition which I use in the school here, which is straightforward. Any substance of animal plant, device, which may be used in either prevention or diagnosis or treatment of diseases of man, plants, and animals, or may be used in the control of disease-causing organisms in man, plants, and animals. We say this is a drug. And when we talk about drugs, we're looking at two things. What the white man brought to us, which we call orthodox medicine, or what we use locally or traditionally, which we call traditional medicine, which may include herbal medicines and some other things. So these are the two main arms of medicines or drugs. Now we need to understand these drugs that we're talking about. The first issue is that it is a weapon which man has. They are weapons of war against diseases. That's why it is like a gun, a bullet, a pistol, a gun that can the pathogens or even the human being using them. The orthodox or traditional are poisons, all with no exception. And the safety margin, the difference between what from one drug to another. For some, it may be narrow, for some, it may be wide. And because they are poisons, people, the government, the government need to license persons to handle these poisons. And the only professional licensed to handle these poisons are called pharmacists. I want to lay this foundation. Now, when we talk about drug problems, there are several of them. I've just mentioned 4 here. We have drug abuse, drug misuse, illicit drug use, and drug addiction. Under drug abuse, we can simply define that as the use for purpose of creating pleasurable effects. Example, when somebody mixes tramadol with Coca-Cola, he's using that to achieve some pleasurable effect. So we can say he's now abusing tramadol, which is a drug that can be used normally. The second one is drug misuse. When a drug is used in a way that is not consistent with legal or medical guidelines, then the person is doing drug misuse. Illicit. This is now where you are using highly addictive and illegal substances, such as marijuana is still illegal in Nigeria and illicit, and it's addictive. So that is illicit drug use. Then drug addiction is when a person now has compulsive drug seeking and use desire, in not minding the adverse consequences that it may cause to that person or the society. So these are just shades of drug problems we may have or we are having because of the COVID-19 pandemic. Now we are zeroing in on drug misuse. Drug misuse. And we have said that is when you use a substance, a drug, a chemical substance, for a purpose not consistent with legal and medical guidelines. That's according to WHO. It is like somebody using a pistol to shoot himself into the mouth. Consequences. There are consequences when we misuse drugs. We have said that drugs are poisons. So there are consequences when we misuse them. I've mentioned 5 of them. One is dependence. In this scenario, the person finds it difficult controlling the use of the substance because what we normally give a particular effect, a particular pleasurable effect, the quantity of drug that will give that effect will keep increasing. And so the person ultimately depends on that substance or drug. Physical health can be affected. It may affect the respiratory, the cardiac issues, drug overdose, abscess in the cases where people do injections. Mental health, we're in a scenario where there are lockdowns and the psychological state of people are shifting. So drug use and misuse can also increase these mental health issues. Anxiety, depression, fear, suicidal thoughts, social difficulties in relationships, financial difficulties, unemployment, homelessness. These are all consequences of drug misuse. It can even lead to criminal justice problem where a person begins to steal or to be violent because he needs money to sustain drug dependence. Now, we have all heard and we all know that COVID-19 was first reported at 1st December 2019. And then we saw the first case in Nigeria around 25th of February, and it was confirmed here in Nigeria 27th February. And then what has that led us to? Lockdowns, travel restrictions, supply chain disruptions. You want something, you cannot easily get it. Budgetary increases, jumps in prices, psychological disruptions. These are all consequences. Now, how did we manage the scenario, the situation we found ourselves? A lot of us resorted to self-help remedies. During the Ebola crisis of 2014, a lot of people started using salt baths, drinking salt, leading to hypertension. And in this scenario, people did some self-help remedies, notably steam inhalation, because people were thinking heat, when it passes through the nostrils, will kill off the virus. Lime, ginger, spices, vegetable broth, these are things people are doing to help themselves. Immune boosters, products, concussions here and there. Now, this is a Nigerian Teaching Hospital cocktail for COVID-19 that was circulating sometime last year. You can see number 1 to 10, how heavy, polypharmacy, hydroxychloroquine, azithromycin, losartan, dexamethasone, ivermectin, 12 milligram, then 12 milligram 48 hours later, doxycycline, vasoprene, zinc, vitamin C, maximum dose being used for 2 weeks. The maximum dose for vitamin C is 1,000 milligram daily. And then for those that can afford it, intravenous remdesivir and all that. This is what looks like a cocktail. I think a lot of people have abandoned this kind of thing. That will tell you that a lot of the drugs we have already were used and misused during the pandemic. So we'll give examples. Now, there are 2 approaches which people are adopted. 1 for prevention, 2 for treatment. And the major drug which people have used or abused during this COVID period is ivermectin. I am aware because we have done a study, or we are doing a study on ivermectin. And we saw that 13.5% of our people, sampled population, were using ivermectin for treatment, prescribed by health professionals, physicians, pharmacists. We saw also that 42.8% of people sampled were using ivermectin for prevention of COVID-19. And that's a very big figure. And we're going to see later the facts about ivermectin, whether they are good or bad or approved for COVID-19. Then we have chloroquine and its brother, hydroxychloroquine, zinc, then immune boosters, vitamin C, vitamin D. Then on the other side, because of the psychological effect of the pandemic, we had increase in addiction. Drugs such as tramadol, cannabis, benzodiazepines, codeines, these were all abused during this period. So we're going to zero in on 2 drugs, one, ivermectin, and then lastly, the COVID-19 vaccine. This is a statement by Merck. Merck is the oldest pharma and chemical industry in the world that actually owns the product called ivermectin. And this is the statement they put out when people began to misuse ivermectin. They said no scientific basis for a potential therapeutic effect against COVID-19 from preclinical studies. They also said no meaningful evidence of clinical activity or clinical efficacy in patients with COVID-19 disease, a concerning lack of safety data in the majority of studies. That's from the owner of the drug we are using or abusing. Now, when these issues were happening, people were doing all kinds of studies. On my right, I have a study that says ivermectin is useful for treating mild COVID-19. On my left, I have a study that says ivermectin not a treatment for COVID-19. So there is this confusion. Which one do we believe? Lagos State government, what did they do? They ensured adequate stock of ivermectin, meaning that somehow they believed that ivermectin is maybe the answer. Then they ran short clinical trial to ascertain its efficiency in our population, that's in Lagos, to prevent and to treat COVID-19 infection. That was their approach. Apart from ivermectin, we were fortunate to have COVID-19 vaccine generated, developed, designed, developed within 1 year. So right now we have about 8 of them approved. And this is just a sample, the most popular ones, the Pfizer vaccine, the Moderna vaccine that are based on messenger RNA, and then the Oxford AstraZeneca vaccine, the Russian vaccine, Sputnik, that are based on viral vectors. And what is available in Nigeria is the #1 AstraZeneca vaccine. Why the COVID-19 vaccine came out so fast? Why? We have 3 reasons why it came out so fast. The increase in knowledge increase, especially in the area of genomics. You know, year 2000, there was a global press conference between Tony Blair and Bill Clinton announcing the completion of the Human Genome Project, which started in 1996. And actually, this century is a century of genomics and bioinformatics. Because what it means is that we have the data, we have the capacity to generate the alphabets that make up every human organism, human beings, pathogens, and so on and so forth. So it was easy within a short time to sequence the SARS-CoV-2 virus. So that aided the generation of these vaccines. And if you understand the area of genomics very well, you can cut and join. You can cut and join. The second thing that helped this vaccine to come out fast is funding increase. Now the whole world was shut down. So people invested a lot of money to make sure that we come out of this issue as soon as possible. A lot of money were invested. The third factor was the first to market pressure, because it is also an economic issue. If you're able to put your drug and your vaccine into the market, you're going to put something into the market, to put the vaccine into the market. So COVID-19 vaccines accelerated, but no corners were cut. No corners were cut. That's the truth, the fact about the matter. Accelerated because the money was there, the facilities were there in many countries, and people were eager to work, but corners were not cut. We know the process of drug design, development, discovery and development is a long process. But when you have all you need and the knowledge is there, then it can actually be accelerated. So how different COVID-19 vaccines work? People have talked about it, but basically there are these 4 areas. We are very much used to the third area, whole virus, where we attenuate, we weaken the virus and now formulate and administer. The other old approach is to get a protein subunit of the virus, formulate and administer. The new ones are this viral vector, where you get a virus that is harmless, you cut out the protein vector and then formulate and administer. The most recent one is the messenger RNA, where you get the, from messenger RNA, you can now translate into a protein. So that messenger RNA that is responsible for the protein, you get it out, you cut it out, you formulate it. When it enters the body, it translates, it produces the protein. The protein is now seen as an antigen by the body, and the body will now begin to generate the antibodies. So these are the four main mechanisms by which we can design and develop vaccines and put them into the market. So what happened about the mRNA vaccines? 3 decades in the making, development, studies, investigations, left and right. Their main problem was that the synthetic messenger RNA was unstable. Just like we had artemisinin as old as several centuries, we couldn't make use of it in the orthodox way until 1971, when people isolated it because it was very unstable. And then we started doing some synthetic derivatives. And now today we have artemisinin derivatives being marketed because we have conquered the issue of instability. The same problem we had with messenger RNA. That solution was figured out in 2005 during the Ebola vaccine technology issues. So as soon as 2020 came and there was this challenge of COVID, it was that same technology that was deployed. So it was like preparation plus opportunity met at a particular junction. And that is the success story that we're celebrating today. Now, the vaccine that is available in Nigeria is called AstraZeneca. And there have been a lot of studies and investigations, both the good and the bad, being said about it. So I want us to critically look at it because that is really where we should focus. As of today, over 25 million people, including my humble self, have taken the vaccine called AstraZeneca vaccine. Over 25 million. Efficacy. I've just taken the first dose. Efficacy is about 76% by the 90th day after the single dose. So that's a very good result. Very good result. However, there are reports of blood clots globally, dozens. Extremely rare, even though it's a big and terrible problem, but is extremely rare. That's the report, extremely rare. And it occurs mainly in younger people. About 18 deaths have been reported. As of today, I've not heard of any report of blood clot in Nigeria. If you have heard, tell me. We have already administered about 1 million doses. So if we have 0 over 1 million in Nigeria, because when the issue of vaccine was coming up, I was always of the opinion we need local research. Because what is happening in other countries, that is what we call pharmacovigilance, phase 4 clinical trial. What is happening in other countries may not happen in Nigeria. Currently, the data is 4 cases in 1 million, which is 0.0004%. We're looking at benefit against risk of blood clots. Now look at the risk of other issues around us. Birth control pills. The risk is 500 to 1,200 cases in 1 million women. This is 0.05%. That of AstraZeneca vaccine is 0.004%. Look at the risk of blood clot when you smoke. The risk is 0.18%. Look at the risk of blood clot when you catch COVID infection. The risk is very high, 16.5. So when we talk about risk-benefit analysis, this is what we should be doing. The benefit is there, the risk is there. You now weigh the two and make your choice. Vaccine use success stories. Now, we know that vaccines have been used in the past and we have achieved results. We had smallpox eradicated, completely eradicated. This is the graph, how it went up 1949 and then came down to 0 by May 1980. Eradicated completely because of the use of vaccines. Similarly, we had the case of polio, which remained with us. There was this country, group of countries called PAIN countries, PAIN, Pakistan, Afghanistan, India, and Nigeria. The worst of the countries with respect to polio. And successfully, Nigeria was able to exit that in August 2020, which is a good case. Now the question is COVID-19. Are we going to achieve the same result with COVID-19? If the other countries achieve elimination of or control of COVID-19, Nigeria, are we going to lag behind in the same way that we lag behind in polio? I want to believe that the answer should be no, but we need to work hard on that. Now, the main issue is called COVID-19 vaccine hesitancy. That is somebody saying that he does not want to take the vaccine, not minding the good side and all that. So from reports, we say 35% of Black Americans don't plan to get the vaccine, 35%, very high compared to other Americans. In Nigeria, the Federal Ministry of Health reported that 50% of Nigerians are willing to take the vaccine, which is a good figure, but not very encouraging. We did a study in a university in Nigeria, and we saw that 42.7% of a Nigerian university community are not willing to take the vaccine, which is a bad news. Only 35.4% of the same Nigerian university community are willing to take the vaccine. Only 35.4. Now, there are some people that are on borderline. 21.9% of the same Nigerian university community may be willing to take the vaccine. And what are the factors that influence COVID-19 perception? In the study we did, we saw 3 factors that were influencing perception. One was marital status, the odd ratio of 2.07. The other was age, the odd ratio of 0.54. The other was religious affiliation, the odd ratio of 0.34. So you can see that one of the things influencing perception of COVID vaccination is actually religion, which actually correlates with what Nigerians are known for. Reasons for COVID-19 hesitancy. From our studies locally, we saw that safety and effectiveness are the major contributors to hesitancy. That is doubts about safety and effectiveness. And actually 66.6% are willing to take the vaccine if the safety and effectiveness issues are sorted out. And what it means is that we actually need some local data to show the safety of the vaccine in Nigerians and the effectiveness of the vaccine in Nigeria. I somehow seem to think that maybe the government is not giving out all the information they need to give out in terms of safety. If we have had 1 million people vaccinated, do we have any blood clots? If the answer is no, then let that data be out to the public so that we know that we have 0 over 1 million in terms of blood clots for AstraZeneca vaccine. The other reason is source of vaccine. People are quarreling with the source of the vaccine. And the answer I have for that is it may be time for us to introduce small brands. Maybe we bring the mRNA Pfizer vaccine into Nigeria for people who may want to have choice. You know, we can also fast track local production because, I mean, if the vaccine is produced at my backyard, I believe that will increase the trust that people may have on the source of the vaccine. Some people still believe there is nothing like COVID-19, and what we need is to do more education in vernacular. The trust deficit on the government is always there. What we need is to improve transparency in governance, especially with respect to COVID-19 issues. Fear of genetic modification. What we need to do is to educate the people. Hasty production of the vaccines, we educate the people. Back of the beast, that has to do with religion. I read the Bible a lot, and in the Bible it is said that the mark of the beast will be given at the right hand or on the forehead. Very simple. So if the vaccine is given on the left hand, then it's not the mark of the beast. So nobody should dare give the vaccine on the right hand. Otherwise, you propagate vaccine hesitancy or even attempt the forehead. If there is something like a patch, a vaccine patch, you know, then there are too many conspiracy theories that are confusing people. So the answer is that we'll keep countering the facts, countering the conspiracy theories with facts and figures. So going forward, what we need to do is to achieve herd immunity in Nigeria. And the definition is clear. Enough people having immunity to an infectious disease, whether through previous infection or through vaccination. Herd immunity is the ultimate goal of vaccination. When a disease is more contagious, then you need a higher threshold of immunity to achieve herd immunity. Example, for measles, we need about 95% persons to be immunized before you can achieve herd immunity. Some studies have shown that estimated that we need 70 to 90% immunity for you to achieve herd immunity for COVID-19. And that is the only time we can actually control the infection in Nigeria. This is a forecast for America for their achieving herd immunity. My question is, can we forecast herd immunity in Nigeria? Based on the fact, the rate at which we are vaccinating Nigerians, I can tell you that a lot of people are not coming forward for vaccination. Some of the vaccines may actually expire or spoil in where they are kept because people are not coming out. So something drastic must be done. And then if we reduce hesitancy, then we can actually estimate when we are likely going to vaccinate enough people to achieve herd immunity. So going forward, the answer is go and vaccinate. Myself, I've vaccinated myself. I was vaccinated 22nd March 2021 by 10 a.m. at Government House Clinic in Anambra State, and I have my card. So every Nigerian should be encouraged to vaccinate. The vaccination is like a seatbelt model. We need to look at it like a seatbelt. It protects the user from severe consequences. It does not mean that the driver should drive carelessly on the road. It does not mean so. Prevention is always better than cure. So if you are sick, whether from fever, malaria, whatsoever, you may never know whether it is COVID or not. Seek healthcare early whenever you are sick. Get your prescriptions from qualified physician. Ask your pharmacist to fill your prescription. Very important. Drugs are poisons. Always get your drug information from your pharmacist. A lot of people use traditional medicine. Seek information before you kill yourself. Shun conspiracy theories. However, continue the COVID-19 protocols. Continue to cover your face, your nose with face masks, hand washing, hand sanitizers, physical distancing, avoid social gatherings. When you must be in social gatherings, use your face masks. Concluding notes. Drugs, including vaccines, are good when used for intended and approved purpose. Drugs can cause harm or kill when abused or misused. The COVID-19 pandemic is real. Vaccinate yourself and loved ones for the common good, and we will all be good. Thank you, and God bless you. Thank you.
I think Professor Uzachukwu deserves more applause. We should give it to him. He has said it all. You will remember when I introduced him that he represents the future that we all desire when we're able to do justice, make research, and contribute to the world body of knowledge on old, emerging, new diseases. And we should be able to put ourselves in a position where these remedies can actually come from our own environment here, and we don't have to always depend on what we get from other nations. I think at this point I need to make the comment which the president of the Academy of Pharmacy and the Nigerian Guild of Editors have asked me to pass on to you. Now, the purpose of organizing this program is to answer questions, is to provide information, is to be able to give a platform where there can be healthy debate on the subject at hand, COVID-19 pandemic. You may have your points, you may have your position, you may have this or that, but in the midst of confusing information, confusing report, confusing conclusions, it was a decision that was taken that, look, let's create this platform to discuss the topic one by one, to bring in the experts to discuss this. So if you hold a position that this is what you think, all you need to do is to put it on the table and it can be examined. This program has got nothing to do with government. It is an initiative of the Nigerian Academy of Pharmacy and that of the Nigerian Guild of Editors. And the purpose, the number one purpose, is to provide information, is to answer your question. There are no questions that you have put on the table that will not be dealt with, either during this program or even after. But I want to plead with you. Once you are, don't be so judgmental in your comment. Once you have put your own position down, wait for a reaction to that, your position. But we appreciate you. We appreciate all the comments. Keep it coming. That is the purpose of the program. We are getting there little by little. Thanks to Professor Ike Uzochukwu for the beautiful presentation. Let me also mention here that Professor Uzochukwu has been saddled with the responsibility to look at all the comments, all the points raised, and provide a comprehensive, report which will be submitted to the presidency at the appropriate time. At this point, let me now call on Pharmacist Obiageri Iko to introduce the moderator of the day and the panelists for us to go into the panel discussion. Please give her a round of applause.
Today is day 4 of our program organized by Nigeria Academy of Pharmacy and Nigeria Guild of Editors. It's a privilege to be here to carry out this assignment. The topic for this course is drug use and misuse during the pandemic. The moderator for this program is a woman I'm privileged to introduce. She's a pioneer dean of Olabisi Onamojo University, and she's currently the chairman of Board of Fellows of the chairman of Board of Fellows of PSN. And she is a woman that's worn so many caps. Currently, she turned 70, and I was just wondering whether she's 50. Ma, you're welcome. On the panel, we also have Dr. Ekanem Nseabasi, a public health specialist, a public health analyst, a pharmacist that has keen interest in global health areas such as HIV, AIDS, TB. He has done a lot of work on hepatitis too and has won so many awards. Sir, you're welcome to the panel. And also we have Dr. Mohammed Zango. He's the first pharmacist managing director of NMPC Medical Services. You're welcome, sir. And lastly, we have pharmacist Sani Bello. He's the former special technical advisor of the Honorable Minister of Health, and he has been technical assistant and senior technical assistant to 2 different ministers. He has been a pharmacist that has done a lot of work in his area of specialty. You're welcome, sir. Ma, you can have the floor.
Thank you very much. A round of applause for her. I don't know how she did it, introducing these gurus and with so much on their CV, but she managed it very well. Thank you very much, Ma. Let me stand on the existing protocol on all the recognitions here this morning because we do not have the time to go through that. But permit me to recognize our very dear president of the Nigerian Academy of Pharmacy and all fellows of the Academy. Well, I will also add PSN and the West African Postgraduate College of Pharmacists who are on the platform. The president of Nigeria Guild of Editors and members of the editors also on the platform. And also appreciate all stakeholders who had made this program possible. It's been a wonderful full program since it started in earnest on Monday, and we want to thank all those involved. I will go straight to the business of the day. Professor Ike Ugochukwu, excellent presentation on the drug abuse and misuse, use and misuse. Thank you very much for that. And also thank you for that Nigeria Teaching Hospital cocktail that you gave us. I didn't even see that in the social media, but I'm amazed that I tend to believe it's fake. It may not come from a Nigerian teaching hospital, but it's wonderful what the social media can do. I welcome a panel of discussants, heavy, made of real pharmacists that are seasoned and administrators and who are at the top of their career. I want to sincerely welcome Dr. Nseabasi Ekanem from my neighboring state, Akwa Ibom. I'm from Calabar, whether they like it or not, the Ekiti people around. I also, who is a public health specialist and pharmacist. I also want to welcome specially Dr. Mohammed Musa Zango, Fellow of the Pharmaceutical Society of Nigeria, FPSN. I'm Managing Director, NMPC Medical Services. I checked your credentials profile, and it said, a confident, creative, and seasoned administrator of unrestrained integrity and professional competence in delivery of quality and safe health care. Mr. MD, that's why you are in that seat. I pray you will continue with that. The last but not the least, pharmacist Sani Bello, a seasoned administrator and has been special assistant. It's nice to have you on this panel. So ladies and gentlemen, you can see how rich the panelists we have here today. So I now invite, respectfully, pharmacist Ekanem Nseabasi on stage to set the ball rolling. What do you mean by the terms drug and drug misuse? I know the speaker has done a lot on this. What were the drugs actually misused during the pandemic? Were they misused? If they were, for what reasons, and so on and so forth. So pharmacists, no, Dr. Ekanem Nseabasi, you have the floor.
Thank you very much, and a very good morning to everyone. I really want to stand on the existing protocols, and first I must say that I really enjoyed the lecture presented by the keynote speaker. It actually shows that we have a whole lot of knowledge of what is going on and what should be done. Well, let me answer the question now. Well, for me, I want to address this issue of the drug misuse from about 6 different perspectives. Basically, drug misuse is using drugs inappropriately, using medicines inappropriately. But I want to study it in 6 ways. Number 1, taking a medication that is not prescribed by a legal prescriber. Medication that is prescribed by an illegal prescriber. If you take that medicine, you have misused it. Number two, taking medicines that have been prescribed by a prescriber, but in an inordinate way. For example, you are told to take a medication for 6 days, and after taking it maybe for 3 days, you feel better, and then you abandon. Or you're supposed to take a medication for probably 1 week, and perhaps after 1 week, you just feel that you should probably take it again, so you continue to take it. That's a misuse. Now, if you use a medication for an indication not recommended by the prescriber, that is also a misuse. Sometimes people take medications that have been prescribed for others for a condition they feel is theirs. If you take a medication that was not prescribed directly to you, but probably to someone else who you feel that probably is going through the same condition, that is a misuse. And I tell you what, during the COVID-19 vaccine, as a public health specialist, I moved around because I was always a guest at some of the most prominent TV stations in Nigeria, channels, TBC, Arise News, and of course Lagos TV and all of that. So as part of my personal responsibility, I move around. I try to gather information on what is going on. Let me tell you one of the things I realized. During the heat of the pandemic, as soon as the news started making the round that ivermectin, in Australia has been seen to be somehow working, I tell you that in less than 24 hours, 54,000 cartons of your ivermectin was sold out in less than 24 hours. People started abusing. In fact, people started calling me and saying, look, I have already purchased a carton of ivermectin for myself and my family. Now, honestly, during the pandemic, there was a huge misuse of drugs. People now became their own personal physician. And of course, access to to prescribers was limited. People go to the hospital, they are sent back, and so when they come back, they become their own doctors. So you begin to see people taking medications based on their instincts, not based on medical science, not based on the prescription of a prescriber. And some of these medicines are prescription medicines. So you see, the situation was quite dire. And then, of course, we also saw the fact that at that time, drug merchants used that opportunity, got into that opportunity to make this business. So you see individuals moving to Idomota in Lagos, moving to open markets in Kano, in Onitsha, and buying medication, antibiotics. Honestly, I tell you something. At the crux of COVID-19 pandemic, there was a huge misuse. I was the supervisor for the Fleming Fund mapping antimicrobial resistance and antimicrobial consumption project in 2020 to 2021. And my work was to monitor the consumption of antibiotics within this period. And it happened to be the pandemic year, the heat of the pandemic. And I'm telling you that the data I have with me is not something to write home about. So really, there was a lot of abuse. And I maybe before in the discussion further, I'm going to outline some of the things that I believe actually catalyzed or fueled this misuse. But the most important thing here was the fear of COVID-19. People did not get the right information. People were not updated on information. Chloroquine, hydroxychloroquine, ivermectin. Once people see messages on WhatsApp, see it on Facebook, on Instagram, on Twitter, they just feel that this is the approved, drug of choice. And so you begin to see people getting this medication. So honestly, there was lots of misuse.
Thank you very much. Thank you very much. You actually used the 5 minutes you were supposed to use. Thank you very much, Dr. Ikanem. Yes, there was a lot of abuse, you said, of drugs. And you also said that the fear of COVID-19, caused a lot of this abuse. Yes, especially when there was no information, coming from the rights quarters. On this note, I will now invite our very seasoned Dr. Mohammed Zango, FPSN, to take the floor. MD, a lot of drugs came up in the management of COVID-19. Some were controversial and still are, some acceptable, some expensive, while some were so cheap, even while some were saying that they don't work, they're not effective, yet we also have other people writing that they are effective. Now, I want you to tell us in COVID-19 management, what's the role of ivermectin, and can the use of hydroxychloroquine be justified? And what role do steroids play in the prevention of the disease? This is on COVID-19. And I also want you to quickly, within the 5 minutes also, would the vaccines be useful in the prevention and how? You know, you have the floor now, sir.
Thank you very much, Chairman and moderator. And thanks for your comment, your initial comments. We're doing well here. Whatever we're doing here, we deliver as a team. And I want to show you my strategic partner. Because I know you are over there, but part of you, Chairman, is also here. I just want to quickly. I don't know, Madam, whether you can see. This is Dr. Adesoji, your son here with me. So you are there, and part of you is here. Thank you very much. So very quickly, yes, there has been a lot of controversy and issues around the use of various medication during the COVID-19 pandemic. Specifically, let me mention the ivermectin that you have first mentioned, which we all know to be a drug that is used for treating parasitic diseases like onchocerciasis, which is the river blindness, and scabies. But somehow, somewhere along the line, it was being now used for the treatment of and sometimes prevention of COVID-19. So because of that, a lot of research had been carried out by different researchers in different parts of the world. And the summary is that it has not been proven, there is no sufficient evidence to show that the drug has any therapeutic effects. Two, there is also no evidence to show that it has any clinical efficacy. But most importantly, there is no sufficient data to guarantee the safety of this drug in the treatment of COVID-19 patient or its prevention. So because of that, it has not been recommended that it should be used for that purpose. Even though some also laboratory research and investigation showed that it has some level of activity or efficacy in the laboratory, but then you will require a heavy dose to be able to achieve similar efficacy when used in human beings. So that has generally thrown the drug away from use except within clinical trials. The second drug, hydroxychloroquine, which is also a brother to chloroquine, are not new drugs to us. We have known them for a long time. We use chloroquine for treating malaria, and the hydroxychloroquine is used for rheumatic diseases. But somehow also along the line, there has been a lot of advocacy by different groups that it can be used for the treatment of COVID-19. At a point, at the peak of the pandemic, FDA gave emergency use authorization to use hydroxychloroquine and chloroquine in treatment and prevention of COVID-19 diseases. But following serious research and data, it has discovered that it has no significant effects in treating or even preventing COVID-19. In fact, it has been discovered that the side effects of hydroxychloroquine or chloroquine completely outweigh the potential benefit that people thought it had. And for that reason, the FDA revoked the emergency use authorization of hydroxychloroquine and chloroquine as well. And at a point, even WHO, which has agreed it could be used during clinical trial, finally removed it completely from the trial risk. So I'm talking to you now, it is not recommended these drugs are being used, even though a lot of institutions, organizations claim that COVID patients generally enjoy such benefit from the use of those drugs. Then you also asked about corticosteroids, which we know basically they have anti-inflammatory effect as well as anti-allergic activity. And these are practically some of the advantages that have been employed in using them in COVID-19 patients. From my own experience, we discovered that patients that have very severe effects from COVID-19, infection, especially at the stage where they require oxygen or ventilation, this corticosteroid actually help them out of the trouble. Particularly dexamethasone, when it is used at a low dose of like 6 milligrams, it helps a lot. So for that reason, it has been recommended, even though the research is still going on, that for patients who have COVID-19 and who have moderate to severe, infection, are encouraged to use that drug, and they will benefit a lot from it. For the vaccine, yes, the vaccines are available, they have been used, and from the information that we have from all the authorities in Nigeria and globally, it is said to be safe, and therefore we encourage people to go for vaccination. But just like the COVID-19 itself, when it newly came, we didn't understand it. We had the whole of last year, there was so much confusion, there is so much knowledge, less information or understanding about the virus. But today we have understood the virus much better, and we'll be able to navigate around the situation to come out. So also it applies to the vaccine. The vaccines are still quite new to all of us. We don't know everything about the vaccine, but from the information we have gathered, it is quite safe. But I know as time goes on, we will be able to have a clearer picture of what really the side effect of both vaccine are. But for now, it has been clearly demonstrated that the benefits, of using the vaccine has outweighed the risks that may be associated. And since we are in a pandemic situation, the best way to go about it is to, get vaccinated so that you can protect yourself and probably protect, you may not protect others, but you can protect yourself in case you are able to get the infection. It will not be as severe as when you have not taken the vaccine. So by and large, I would say the vaccine itself, based on the information available to us, and we will encourage people to actually do the vaccination. Here too, we are not folding our hands. We are encouraging our staff and their entitled family to go on the vaccination exercise. As I'm talking to you now, we have done over 4,000 in my corporation, and we have not actually received any severe, any report of severe side effects. Though there are small side effects here and there, which most of them they resolve after 2 or 3 days. So we will encourage people to continue to go for vaccination. But of course, we have to disseminate as much information as possible. So I would also want to say that if we actually want to succeed in disseminating this information, we need to support the media because they are very critical, they are very strategic in their information dissemination. Before I finally drop, I know the time is not on our side. I want to say that we are still not very prepared. We need to really buckle up. This pandemic may not be, the last one. So therefore, I will urge all of us in whatever capacity to ensure that we contribute our quota towards developing our infrastructure and then invest in healthcare so that we can prepare ourselves for the next pandemic as much as we're struggling to fight for this one.
Thank you very much, MD. Thank you. Yeah, you've talked about the drugs. Thank you very much. And yeah, I think the best thing, we should go for the vaccine. The benefits far outweigh what they're saying about the risk or whatever it is. We will definitely go for the vaccines. And thank you for encouraging everyone in your establishment and their families to do so. I wish all MDs and the CEOs will do that, ensure that those working in their organizations are vaccinated along with all their family members, etc. Thank you very much. Let me bring on board pharmacist Sonny Bello, Dr. Bello, a very competent and distinguished pharmacist. It's my pleasure to invite you to the floor. There are quite a number of vaccines approved for use globally, and we have 8 of them mentioned by the keynote speaker and also the chairman of the occasion, our own very revered professor. Do you think Nigeria made the right choice in selecting the particular vaccine currently being used in the country? And the vaccines without side effects, okay, we've answered that already. If not, what are the common side effects expected, at least with the ones in Nigeria? And is the use of antibiotics in managing COVID-19 rational? Also, how about medicines? A lot of us, including healthcare frontline workers, were using herbal. They drink it before they go. Those who never even took all these herbal medications and agbo, suddenly they started, they were on it. A lot of these are projected everywhere, especially the social media. How safe are these? How effective are these remedies? And what is your candid advice to Nigerians on the right drugs to use in the management of the disease? We've heard a lot about drugs from Dr. Zanko, so you may just just a little bit. Over to you. You have the floor. Thank you.
Thank you very much, Madam Moderator. Permit me, first of all, to express my sincere gratitude to Almighty God for giving the leadership of the Nigerian Academy of Pharmacy and the NGE the wisdom to create this important opportunity that avails the Nigerian population the chance of being a light appropriately on COVID-19. Apart from after that, I think I will just, because of time exigencies, I will go with the existing protocol, and I'll start answering your question number 1 about the choice of vaccine. As all of us are aware, in a situation like this, when we have a pandemic and limitations of availability of logistics, particularly the vaccines, definitely is in short supply. And if you are at disadvantage of position of not being producing your own vaccine by yourself, definitely you have to rely on other sources. And these sources are external. Therefore, Nigeria as it is for now, or the entire African continent, we are in a position of beggars. Therefore, we have no choice of what vaccine we have to get for now, because we are relying on patronage from other countries. The present supply of vaccines that we received, about 4 million doses recently, was from a facility called COVAX. The COVAX facility was established by a coalition of non-governmental international actors in the healthcare system, comprising of WHO, UNICEF, Gavi, SEFI, and the rest. They came together to form a facility that is to guarantee equitable distribution of vaccines to all nations of the world, particularly the middle income and low income countries like Nigeria. So we now decided that we should get the AstraZeneca vaccine, which we have for now. And that decision, I don't think has anything to do with the authorities of Nigerian government. But incidentally, considering our own situation, the choice is good. Why? Because the vaccine itself is cheaper than the other messenger RNA vaccines that are being used in the US and UK. Secondly, the supply chain management logistics in terms of cold chain requirement is minimal. And considering our status, I think it's good that we have a vaccine of such nature. Then the second question, that are the vaccines without side effects? Definitely everything that virtually human being ingests into his body, be it through oral or parental, has side effects, including the food we eat. Even the water we drink, if we take it in excess, it becomes a problem. There must be some side effects. Not talk of a foreign body that's being introduced into our, but the side effects generally are mild. Number one is the pain at the injection site. You have issues like chills, you have fatigue, muscular problem, pains, and that appears some few days, about 2 weeks after the first dose. Then, of course, the much talked about clotting, which the keynote speaker has already addressed, and I don't think I would rather consider it as adverse event because it's not a common occurrence. And as it is now, in India, with over how many, millions of people vaccinated with AstraZeneca vaccine, we are yet to get a single case of the blood clotting. And I tend to agree with the keynote speaker that maybe it has to do with the genetic makeup or racial differences. Maybe that problem may not even be available with us here in Africa. Maybe it's a domesticated problem to the Caucasians and the mulattoes. Then the use of antibiotics in management of COVID-19. Yes, antibiotics can be used in management of COVID-19 when you have cases of morbidity or opportunistic infection. That is to say, maybe somebody has COVID, then you have bacterial infection of the chest and whatnot, so you may need to administer antibiotics to alleviate the other problem while you are managing the symptoms of COVID. But by and large, we should be careful when it comes to use of antibiotics, especially through self-restriction, because if you have a COVID incidence of COVID disease, the best advice is to consult the appropriate skilled healthcare personnel to advise you on what to do, not to embark on self-medication. Then the use of traditional medicine or herbal medicines in treatment of COVID. Well, there are many assumptions or many candidate drugs already undergoing clinical trials at various stages with regulatory bodies all over the world. including Nigeria. But without those outcomes coming, then it suffices to say that for now, there are no herbal remedies recognized by WHO in the treatment or or prophylaxis or treatment of COVID-19. But at this point in time, it is important for us to mention that, honestly speaking, we need to do more in the area of research with our local herbs, because I believe if we do it vigorously, there may be light at the end of the tunnel. We cannot always be relying on foreign interventions when it comes to problems that are domestic to us or global issues. So for now, I don't think there's any herbal remedy that has been proven to be scientifically proven to be effective for treatment of COVID through the necessary regulatory agencies. But all of us know, right from time immemorial, there are literatures that indicate certain herbal products are very good when it comes to boosting of immune system. And of course, if your immunity is enhanced, you become less sustainable to any infection, including COVID. So we should begin to encourage use of such herbs in times like this. I'll give you a typical example like garlic, ginger. All of us know they are good for respiratory disease. So there's nothing wrong if those things are being taken with moderation, just to boost our immune system. Then the other issue is that of the preparedness of Nigerian health professionals to render medicine information with regards to COVID. When you are talking about the issue of medicine information, the first professional that comes to mind is a pharmacist. But unfortunately, that cadre of health workers or worker has been relegated to background in the fight against COVID, especially in our own climate. Most people, when they have issues, the first point of contact are community pharmacists. And it's when they see the community pharmacists that they go to the higher level when the need arises. But a scenario exists as of today where community pharmacists are not involved in the corona campaign issue. Look at the national task force. There's no pharmacists on board, and all other committees at state level, you don't see pharmacists involved so there's that handicap of dissemination of information of drugs related to COVID-19. So it's our candid advice to government to see if they can reverse the trend, to involve not just the pharmacists, all healthcare professionals, and including community leaders, so that we join hands together to fight this menacing war to a standstill. Yes, thank you very much.
Thank you very much,
Okay.
Pharmacist Sani Bello, for what you have said. You have rightly said that there are some medicinal plants that can boost immunity, and that you encourage us to use that maybe in moderation, not abuse, since we are talking about drug abuse. When talking, the keynote address speaker mentioned the fact that Nigeria was, if not the last, for eradication of polio. And he said, are we going to achieve the same results like other countries, or lag behind as we did in polio until August 2020? What should we do to avoid this? Mr. Dr. Ekanem, are you there? What should we do to avoid? Yes. 1 minute, please. Can you address that?
Yes, I really want to say that, borrowing a lead from other members of the panel, the main approach to achieving coverage of COVID-19 vaccine in Nigeria is, first of all, we need to send the right information out. We need to also be ready to address publicly the concerns that people have. We need to update people with information. So create the information, update them, and then dispel misconception. That's the way to keep the people updated about what is happening, so that people will not live either in fear, or people will not live, be ignorant of what is going on. Now the media, thank God the media is here. The media has a very key role. We need to be seeing adverts on the safety of COVID-19 vaccines in our media houses. We need to see billboards. We need to go down to the community, engage community leaders. From what the keynote address speaker said, the religious group play a very key role. We could see what their contribution to the hesitancy. We need to engage religious leaders so that they can talk to the worshipers and get them to understand the benefit of taking this vaccine, so that we will not miss this very important opportunity.
Thank you very much. Thank you very much. You've said all this, the right information, get information out, the billboards and everything. But we have a situation in Nigeria. Nigeria only brought in how many millions of vaccines? Is it 3 or 4 million vaccines?
4 millions.
For 200 million people, assuming adults alone, let's have the percentage for the adults. How do we achieve this? How do we achieve this and not lag behind in the eradication of COVID-19? And how do we achieve herd immunity with just what percentage of vaccines in the country? Knowing fully well that AstraZeneca has to be given twice, 2 doses. So you divide it by half, because they stopped when it was exactly half, so that they can have the other half for the group that had been vaccinated. I'm going to ask Dr. Zango to attempt to help us in this. How do we achieve herd immunity and get everybody vaccinated, knowing fully well that we don't have the resources?
Thank you very much.
Or we pretend not to have the resources, or we have our priority displayed, because 4 million vaccines for 200 million people is absurd. Thank you very much. Go on, sir.
Thank you very much, madam. It's very glaring. It's very clear that we are in trouble, because I don't know where 400,000 or 4 million will even go. And unfortunately, even the source that we are relying on, which is the Serum Institute of India, they are also having a serious surge, and they have, I think, decided not to be exporting vaccine anymore. So I don't know where we're going to get it from. And unfortunately, also, there is serious scarcity around the world on this vaccine, whichever form, not even as AstraZeneca, including the other one. So we are really in big trouble. But since we have sufficient resources, we can't say we don't have the funds to buy the vaccine. I think we can strategically look at other means of accessing this vaccine through probably a private sector that will be able to control. I know there is always a way out on every difficult situation. But then outside the vaccine, what we can do, I think, is to continue to observe the non-pharmaceutical intervention that will help us a lot. And then again, go back to what our last speaker, pharmacist Bello, said, that we should look around, look at some of the natural products that we have, which one can help us, and then generally use them. So if at the end of the day we're able to use the few vaccines that we have with the pharmaceutical intervention and also the natural product, that will probably develop herd immunity, because at the end of the day, that's the only way to go.
Thank you very much. So we still have hope. The vaccines, the natural products, remedies, and the information. and also using the community pharmacists. They are always the first point of call. Even the WHO recognizes that. And they must be involved like we have in other countries, in information, in counseling, in even vaccination. If we have enough, they can be part and parcel of this. Thank you very much. Mr. Is it Bello? 1 minute. We talked about religion being a problem. One of the factors influencing COVID-19 hesitancy is the religion. We have the marital status, the age, and religion. How do we solve that of religion? 1 minute, please.
Thank you very much, Madam Moderator. Just like what previous speakers have been hammering on, I think we should borrow a leaf from the polio war. There was a standstill until the promoters of the polio vaccination program decided to involve traditional rulers. And that is when we started seeing the light at the end of the tunnel. You cannot dissociate, especially in the part where I come from, the northern Nigeria. There's no clear divide between traditional institution and the religious leadership. So if we can involve the community vigorously, community leaders, the traditional leaders, along with the religious leaders, let us make them have a clear understanding and buy-in of the vaccination process so that they'll be able to talk to their followers to do the same. First of all, before you extract serious commitment for anybody, the first thing you should hammer on or work on is to make him be convinced with what you are doing. So government and all the stakeholders involved should do everything possible to make sure that they make these religious leaders and community leaders have a clear understanding of what COVID problem is all about, what it portends for the world economy, world peace, and what it portends for the future if we don't do the right thing. Once we do that, I'm sure we'll be able to get the buy-in of the leaders, and they'll be able to convince their followers, and off we go. Thank you very much.
Thank you very much, our panelists, for the wonderful and robust discussion we've had this morning. I want to state as a moderator that the virus is affecting us is an understatement. It has changed the way we do things and given us a new normal. It's had its toll, about 3 million deaths globally. We thank God that Nigeria's one has been quite low. And the COVID-19 pandemic has also influenced drug misuse and abuse. The increase mental, suicidal, things like that in some quarters, and it's something of concern to us. Our exit strategy in this pandemic is science, as was stated on Monday, and vaccines are products of science through intense research and development. So vaccination is a hope. For now, as vaccines remain the important line of defense to protect the public from epidemic and also the pandemic. There are myths and there are facts, and we know that this is a time to separate the myths from the facts and the fictions. And that's why we put together this program. This is a time to correct the information and allay fears of the people on the myths that we have microchips. Because there are no microchips, no tracking device, and it's not for the depopulation of Africans, etc., etc. But why the hesitancy? I want to state that AstraZeneca vaccines are safe for use, and we need to assure the people that the vaccine is excellent. One shot, we have told, can give you 76%. Vaccines prevent the severity of the disease. The benefits of having the vaccination, it prevents the severity of the disease, and it also prevents death. We are not saying it is totally foolproof, but it is safe. The AstraZeneca vaccine is safe. Nobody is being forced to take it. No. We can only advise and also convince people through proper information and counseling. No, I will advise Nigerians to believe in it and take the vaccination. You will have yourself to blame if you don't take the vaccines. And I want to categorically state and assure the public that we have not been compromised and have not received any funds to organize this program. We are even using our own funds to do it. We haven't, but we are professionals, and professionals must profess the truth, and that's why we're here, to profess the truth. And as concerned stakeholders, Nigeria Academy of Pharmacy and Nigeria Guild of Editors, the facts must be told, and we must charge a way forward for our people. Together, pharmacists, journalists, and other professional stakeholders, we need to tackle the pandemic. And I know we can. We can if we work together. We cannot afford to experience any third wave, as in other countries now, India, Turkey. We cannot afford it. Vaccines save lives, they don't kill. I know this was also said on Monday by our Vice President, Nigeria Academy of Pharmacy. So therefore, go for the vaccine. Get vaccinated. I have taken mine and also ensured my family members did. You know, we all did. But the information I now have is that instead of the 12 weeks that we were given previously for the second dose, it's been reduced to 8 weeks. So people should take note of that. Do we have questions from the floor, not the chat? The anchor person is taking the questions. You will take that. Okay, let me just conclude. I want to thank our distinguished panelists for the very robust, informative, interesting, and beautiful discussion here today. This was made possible by the excellent presentation given by our keynote address speaker and the chairman that started the ball rolling. Once again, I thank the leadership of Nigeria Academy of Pharmacy and the Nigerian Guild of Editors for this partnership in putting together this wonderful program. May this partnership continue to bring relief and quality of life to the good citizen of Nigeria. Distinguished ladies and gentlemen, the chairman, panelists, presenter, it's time to take the question and answer in the chat room. I hand over to the anchor person, Dr. Lulu Ojo. Thank you all for your attention.
Applause for our distinguished moderator, Professor Femi Oyewa. Thank you very much, ma'am. Thank you, sir. Yeah. I'm sure all of us are following in the chat room. I was actually listening to the questions one by one, but what we have right now is not something anybody can list one by one. Now, we have two people who had put up their hand for quite a long time. I will call you to speak now. There is somebody identified as iReport. First, let us know who you are, because iReport is not a name that we can relate to. But you have the floor now, iReport. Unmute yourself and talk to us. But first and foremost, let's know who you are. Let's see your face and be able to listen to you.
Can you hear me, please? Can you hear me, please?
Yes, we can hear you.
Okay, so my video is having an issue, but my name is Patson Manuels. I run an online reporting news agency based in Nigeria here. Now, I've been following the discussions, and I have some concerns, you know. I listened to the professors and the professionals talking about the vaccines and how safe it is. But we have been following this issue for quite a long time. First of all, when the coronavirus issue came up, we were told by WHO, by the likes of Anthony Fauci and people like that, that it's novel, it's new, and that it mutates very quickly. They have not understood it, and it's actually strange how it operates. And because of that, it was going to be very difficult to produce or provide vaccine very quickly for it. Now, we know, based on research and studies, that to provide a safe vaccine, there are safe period, to go to clinical trials and then animal testing. From what I'm a journalist and a lab by profession, but I have studied that it takes between 5 to 10 years before I can safely put a vaccine to test with animals, because within that period, you're able to tell if there are adverse reactions in the animals. Now, the professor that spoke said that opportunity made preparation. In other words, they've been working on this vaccine, mRNA, and so on and so forth. But how can you say it's safe when, first of all, it was something new, it hasn't been understood and studied before? How were they able to prepare the vaccine very quickly to be able to solve the problem of COVID-19? Because he is saying that because lots of money was voted for research, so because of that, they were able to come up with vaccine quickly, but they can't come up with a quick solution when you haven't had the normal testing period on animals. That's number one. And when the virus is also very strange, very unknown, and novel, how would they suddenly come up with vaccine that you can say is safe? Secondly, this vaccine came from the West, from US, from Europe, and all of that. Many of these countries have suspended the rollout of this vaccine. I'm wondering why we are so much in a hurry. In Nigeria, since this issue started last year, I know that the reported death is about 2,010 or thereabout so far. Now, and we do know, many of us have had people that passed on, that died because they could not be treated. Why? They went to hospital, and then once their case is anything close to respiratory, is classified as COVID. I have someone who went to register to do a COVID test, has not done the test, because he registered for the test, next he got a report that is COVID-19 positive. He never had a test. So there are many issues. And now the issue of the vaccine. If countries like South Africa, Ireland, Switzerland, and even America have suspended their rollout, why are we pushing it? Now we're talking about chloroquine and the likes of it. Many doctors have said they used it to treat their patients who had COVID-19. If this thing can be cured by chloroquine and the likes, why are we pushing for vaccine?
I report begin to round up so that I can give other people a chance.
Thank you very much. I'm running up right now. I'm running up right now. So why are we pushing for vaccine when there are clear concerns? Now, someone said that the side effects are few and far between. That may be so, but do we have to have a death to be able to be careful about this thing? So what we are saying is, let us have a robust, and then again, among the scientists, one side says this is dangerous, the other side is pushing for it. So why don't we have a robust debate? Let's have all the facts out there. We are journalists, we can write the truth to the people, and then let everyone make their choice. Finally, please, we said that this vaccine is not compulsory, but let me make it very clear. There are organizations, there are companies that are telling their staff members, without the vaccine, there are no salaries for you, or you lose your job. These are concerns that will need to be addressed. And if the makers of the vaccines are not taking the vaccine, and they are being legally indemnified from the side effect of the vaccine, why should we believe in this vaccine when the owners cannot even give us a warranty on it? But I have a warranty on the TV product. How about what affects my life? So these are major concerns. Please, thank you for the opportunity, and I appreciate it.
Thank you, I report that you could express yourself loudly and clearly here is the sign that we are having robust debate already. And let me correct an impression. Nobody is pushing for the vaccine. All we are doing here is discussing and providing information that we allow individuals to take a decision. Is to be able to shift between all the available information here and there. That's the purpose here. Nobody, I repeat, nobody is pushing for the vaccine. And one thing that we need to understand, transaction on vaccine is between government and government. It's institutional. So may I request Dr. Saidu Mohammed, another person that has been raising up his hand, to speak right now. Are you there? Please, Professor Usochukwu, be ready to answer this, respond to this something. So could we have Dr. Saidu Mohammed? Are you there? Your hand had been up, your comment have been seen. Will you want to publicly now make known your opinion? Are you there?
Can I just come in a minute, please? The last speaker said that many of the countries have suspended the vaccines. That is misinformation. Even as at yesterday, at CNN, I listened to it. The only vaccine that was queried was J&J, that they had to put a stop, Johnson & Johnson, because of some clause, and they're looking into it. But others have not been suspended. The suspension that we have in Europe was more of a political issue, and they all resumed using it. So please, when you are a journalist, make sure you get your facts right. You need to get your facts right. That's what we are saying. The misinformation is so high. The false information, misinformation. Yes, it has some side effects. Even Panadol has side effects. Even going in a plane, a trip has its own risk. I've had to turn back on the road in the air to Calabar, almost getting there 2-3 times with a plane. It's a risk, but I still went on it. So what I'm saying is that everything has a risk. Overeating has its own problems. So please, when we're informing the masses as a journalist, let's make sure we have the correct information. Go and check. The vaccines are still being used.
Okay.
Nobody's forcing anybody. Thank you very much.
Thank you, Ma. There is a Biodun Fasimi whose hand has been up. You may want to come up now. Please, 1 minute so that we can give others a chance. Biodun Fasimi, please. You have the floor.
Thank you very much
and
for
it
the
will have been nice to
opportunity.
put on your video so that we can see you. Let's see you.
Oh, my video. Thank you very
put on
much.
your video. You
I
can
think
see me. You can see me and hear me talk. Put on your video. Let's see you.
Let me see. I think my video is, I'm not in a very well lit place. It's really dark. That's why my video is currently not visible. But thank you. Without taking much of your time, I stand on all existing protocols. Thank you very much for this panel. It's been insightful, and I've learned so much. And also from the other speakers have been very insightful. And I'm here to also allay my concerns with the vaccines. Now, first of all, I also am a data-driven media practitioner. I like to look at data, and I have monitored carefully the number of active cases and the deaths all around the world. And I have seen a particular trend in Africa, Nigeria and Ghana to be precise, which is where I focus my research on. At this time, we have, as at yesterday, we had 164,000 cases in Africa, in Nigeria, and 154,000 have recovered, 2,000 deaths, less than 8,000 active cases. I do not think that with these statistics, we are in a situation where this is the most topical problem in this country. This is partly why many people, many of us, myself and some of my colleagues in media, we don't think that this is a prevalent problem in Nigeria. If you go around, I go around with my camera, I have pictures, videos of Lagos, of many places, flashpoints in Lagos State, with a lot of people out there. Many of them, I go to Balogun Market, I've been to Tedrosho, I've been to Solo Market, Aswani Market, I've been all around the place. And you do not find people wearing masks. Even our BRT buses, government-owned buses all around the place. I stand at Ikeja under bridge many times, just 1 hour recording things so that I can know what is happening. The reality on ground needs to match what we're seeing on the internet. No social distancing, no masks, and these people are not falling on the ground dying. This is the major cause of vaccine hesitancy. It is not that before we go into the maybe blaming the religious leaders and all that. This is the reality on ground. I traveled for an event in Ibadan some days ago. It was a big event. So many people were there. I was the only one putting on the face mask. After a while, I had to remove it before I looked like I came from the moon. So the reality among the people is that this thing is not a killer disease. At first, when it came out, everybody was scared. Everybody was, trying to, because they were told that it's a novel disease, it's killing. We saw people dying. We saw people falling on the floor in China. And they told us that it is this virus that is causing it. And a lot of people began to, we were all following it. Then suddenly we find out that it is not what is happening. So these are the real issues. So if this is what is happening, why are we pushing? Why are we pushing for vaccinating the whole country when we have 8,000 active cases? I dare to say, madam, I'll round up in just about 30 seconds. Please. You said that countries are not suspending it. Yesterday, Denmark suspended it yesterday. It's on the news.
Okay, there are some other.
We have cases of Israel. Denmark has suspended. Switzerland first sold off 5.3 million vaccines of AstraZeneca. Switzerland laid off their own. Same as South Africa. So why are we pushing for it in this country, in Nigeria? These are the real questions that we need to ask. Thank you very much.
Thank you. Biodun, let me repeat that the word pushing may not be the appropriate word. What we're doing here is exchanging the information and putting the information as they are. We are not government. We are not in the position to say tomorrow we should stop vaccine use. We are not in the position to say we should continue. What we're doing is that there is a problem. There are a lot of pros and cons, a lot of information there that need to be shipped. And that is what we have done, providing a platform for that exchange. And that you can speak publicly on your opinion on the facts, on the matter, is as a result of this platform that we have. So just hold, there will be a response to your concern. May I request Assam Bungudu, who I learned is a traditional ruler, may I request that you take the floor now, please, just for a minute. Thank you, sir. We appreciate your coming.
Thank you very much. My name is Hassan Bungudu, as it appeared on the screen. Am I getting through? Am I getting? Yes. Am I getting through?
Yes, you are.
Yes, please go ahead.
I am Hassan Bungudu. I'm the Emir of Bungudu in Zamfara State. I'm very happy to be on this platform, and I have really benefited much from the expert opinions I've listened to. No doubt there has been a lot of concerns and misinformation, and even what they call conspiracies as far as the endemic is concerned. And a lot of people even denying it exists. Certainly, a lot of us on this forum, I'm sure, are not denying that COVID-19 exists or is dangerous or it's even a pandemic. Because if it's a pandemic in several parts of the world and the World Supervisory Agency has declared it as such, I think it's safer for us to declare it as such. Personally, I've taken my jab, and I will also encourage anyone to do it. I will have to state that at least about 100 people have taken the jab where I come from, and I think just one or two had exhibited mild symptoms, which, like people have been saying, might not even be exactly directly related to the vaccine. Whatever the case, people have noted that everything has its own, what do you call it? Everything, even Panadol, has its own side effects, and we'll agree with that. What I would want to posit is that I feel safer to take the opinion of experts than take the opinion of others who I cannot trust my life or my safety to. So I want to state that I personally trust the experts here, as well as trust the experts that I've been listening to all over the world. I know there are concerns. I know that there are risks. But then what have we have woken up to witness about the pandemic in other parts of the world are really horrific. And the fact that we have been lucky, we have not been subjected to the problems other countries had does not mean that we should just wish it away, that it cannot happen to us. People who are reporting that it's been taken, there have been variants here and there, maybe the ones that have come so far do not affect us because of one reason or another. Maybe the kwashiorkor, the malaria, the measles, we have all had when we were growing up, and various vaccines too that we have been subjected to maybe has assisted in seeing that the effect here is not as much as those who do not have the immunity that we have had because of the peculiar situation we have been brought up. But then anything that can come, like we have had polio, we know what happened to that. And like somebody have said, I will also suggest that the government and the other professional institutions like the ones organizing here should, liaise with traditional institutions, religious institutions, because a lot of us in this sector are quite aware that this thing is real, and then something needs to be done about it. I wouldn't want to be seeing people shouting, I will not take. If you will not take, I don't think anybody is going to force anybody, like it has been said. But then for us to shout, we're not taking, and continue happening, they were not taking. I saw somebody making about 100 posts here that I will not take the vaccines. Madam, you are lying. This is not. I think we should be more civil in what we are doing, because all of us were invited here. Nobody forced us to come here. So if we are going to come here, let's at least be civil and then try and see that we understand each other. In my opinion, may not be the same with yours, but then let's respect each other's opinion. By the time we start putting some things like insults here, I think it's not good for everyone here. So I thank you very much for this opportunity, and I wish everybody all the best here. Thank you.
Oh, thank you so much. Thank you so much. It's good that we have you. And the words of wisdom coming from you is quite good. I like it. One, nobody is forced to be here. A platform was provided for us to express our opinion, for us to discuss the matter at hand. Hey, look at me. I took the vaccine, but my wife says she's not taking. Yeah. Till now she says she's not going to take. And I didn't force her to take. I couldn't force her. So it's a good thing. Yes, I still have one hand up. That's Nuruddin, which is going to be the last. Yusman, please, you have the floor. Unmute yourself. We would like to see your face. None of those who have spoken, we have seen their face. And I think, good, let's see your face and talk to us.
Thank you very much. Am I on? Am I on?
Yes, you are.
Okay. My own is that I actually did not intend to speak initially, but I was actually moved when I looked at the kind of comments on the chat board. It was actually very unfortunate and disappointing, some of the comments on the chat board. And I want to put on clear misinformation. And I think the organizers should look at anytime they have to recognize people to speak during their questions and answers, they should look at the chatbots and see the way and manner they comment before they even allow them to speak. The first two speakers, one of which described himself as a journalist and the second one data-driven, when you look at the comments they've posted, actually, they were there to actually misinform people, because the second person said he's a data-driven, and the first one said he's a journalist, and a lot of things on the chatbot they posted were absolutely unfortunate. And I want to say that the various experts have spoken a lot is the logic area. They talk about the sectors they already have a mindset, and those mindsets are driven by the logic of correlating this and correlating this without scientific evidence. And some of the things I want to raise for especially those of us who have mindset and are not willing to change is that let us remind ourselves from the beginning of the emergence of COVID around January, when people were shouting and roaring and sending all those kinds of insults when the lockdown started about the conspiracy of the West to hide cure. That was how it started, actually. People were saying there was a cure, but the West were trying to hide the cure in order to kill the Africans. Few months into the lockdown, the search for vaccines, when the search for vaccines started, the narratives in Africa was that nobody was willing to volunteer to be part of the vaccine studies, whether to be volunteer as part of the those to take part in the clinical trials or anything. Most of the narratives then were that the Europe has conspired against Africans to come and use Africans to develop vaccines. And that was vaccines began to come up. At the beginning, when there was that kind of unexplained death in places like Kano, Sokoto, and the rest of them, we had a lot of roaring and shouting that the federal government was not serious. They have allowed people to be dying unnecessarily, all those kind of things. In fact, there was a contribution to Lagos state government of 15 billion. Nobody was giving anybody to Kano. The federal government team went to Kano. Everything came down. And immediately everything came down in Kano after the whole thing has been.
Begin to round up.
So what we are saying in essence is that let those people trying to misinform the public about the vaccines know that as it is right now, we have more than 10 vaccines going around. Hepatitis, the tetanus toxoid, and the rest of them. Let them know that none of the vaccines is produced by any African. Those people who have produced the COVID vaccines are the people who have also produced the vaccines who have been taken. So I want to tell them that those.
Okay. Thank you, Nuruddin. I guess there's a network issue there. We've gotten your point, and I think you have made your point very, very, very clear. Let me repeat for the opt-in time. The purpose of this is to provide a platform where we can talk about these issues, exchange ideas, and from this experience, we are going to package what we are going to release to the public. So I thank all of you. Yes, if you say there is no COVID, if you say the vaccine is not supposed to be taken, please think about the families of those who have lost their ones due to COVID. What are you going to tell them? We have lost a chief of staff. We have lost a former governor. We have lost a lot of people. 2,000, when you talk about 2,000 deaths, are we talking about death of chicken? We're talking of 2,000 people, human beings, Nigerians. And you feel that we should not be concerned about a subject that killed 2,000 people. All these are things that we really need to package and look. 3 people will speak more before we round up. First will be Sir Ike Onyechi. He has a point to make. Professor Ike Uzochukwu will look at all the comments that have been made. And we have the distinguished presence of Professor Isamate Usaini, who, as a commissioner, has been with us since morning. This is about 12:30. And yet, the program has been exciting. We listened to the 3 of them before we finally round up with the president of the academy. Let me call on Sir Ike Onyechi, please.
Thank you, Dr. Lolu. The president of the academy, the vice president, the coordinator of the well-concluded discussions. Just to make a small point, to add my voice to emphasize that nobody here is canvassing for any manufacturer of any vaccine, that we must take vaccines. We as scientists know the process of making vaccines. We also know as scientists, and even the clotting and other side effects that are coming from COVID vaccine is within the proportions that are observable in other vaccines used for other indications. And this should not be of an unusual concern to us as those who know the process. But that having been said, nobody will force anybody, it's just to put the facts bare. Vaccine hesitancy is real, and we're not making a joke of it. My coordinator, Dr. Lolu, has studied well. He has taken, and the wife has not taken, and he cannot force. In my company, my son has taken, some of us have taken, but many have not taken. So let's get that fact clear, please, so that we don't confuse the public. And the 4 million doses we have for 200 million people is so inadequate that if the grace of God is not holding down the spread of this here, where do you want to get all the vaccines for 200 million people? So let's not also abuse the grace that we are receiving that is toning down the spread. So let's get that. Another concern we have is that the country, Nigeria, should start its own process of vaccine production. That's the bigger thing. It's part of what we're canvassing here. It's part of what we're taking to government. It's part of what we should see them fast track. Because all the countries are keeping back their vaccines, even now. So let us face the right things, not about wondering if somebody wants to encourage somebody to take vaccines. The nation Nigeria is right to make their own vaccines. Smaller countries are making, but we're not invested in that direction. This is a part of what this coalition will bring to government, and even the man in the press talking about anything. Join your voice to encourage the governments to get into vaccine production going forward, even for other areas. Thank you very much.
Thank you very much, sir. I appreciate you. And for everybody in there, much as you have opinion about something, remember others have opinion too. So all we need to do is to discuss this thing together and be able to come up with what is best for those people on the street who are relying on us, for the right information. At this point, I want to call on Professor Ike Uzochukwu within a minute. Just respond to all those comments that have been made.
Unfortunately, I'm not able to respond to all because there are too many, and some of them are really off the line. I will respond to some.
Professor, just spare us the details.
Starting with starting with the
just summarize your response.
Quotation by Karl Marx. Yes, the quotation by Karl Marx that religion is the opium of the masses. Today, social media and conspiracy theories has become the opium of the masses. Somebody will see one video made by one roadside person, will bring it to you and say, look at this, look at this. I say, what am I looking at? I want to listen to WHO. I want to listen to NAFDAC. I want to listen to science articles that are peer-reviewed internationally or locally. I want to listen to facts, not roadside, things. So that is on that. I thank also the people that have spoken. One of them actually acknowledged that this is not his area. So let me address the area that is my area. Drug discovery takes 10 to 15 years. That is well known, traditional method. I said by year 2000, there was a paradigm shift, genomics, human genome project. So right now, drug discovery can take us less than about 2 years. Example is imatinib, which is in the market right now. We discovered the receptor 1996. By year 2000, the drug is already on the market. 4 years. That is how far science is going. When this COVID came, there are a lot of research that have gone into COVID. So you cannot sit down in your beer parlor and say, why are they bringing this drug too fast? Why are they bringing this drug too fast? Many things are happening you are not aware of. So we are telling you what is happening. These things can be done, and they have been done. But if you don't want to take the vaccine, nobody is compelling you. On the issue of, I raised some data here, which some people are saying, where is your source? I say, I am the source. I am a scientist, I'm a researcher. I worked on perception on COVID vaccine. I worked on pharmacovigilance of ivermectin in this country, and I have the data, and we're working on publishing them. So I've just given you a preview of some of the information or data that we have. Issue of discontinuation. Yes, many countries may be stopping, discontinuing this and that. That is why I said that our government has not done enough, because we need local research, we need local data, especially with these adverse effects such as clotting in AstraZeneca. We need to have the facts on the table, transparency. In that way, we'll be able to convince people. If there is no blood clot in Nigeria, then we don't have any concern with respect to blood clot, but we need to show that scientifically. That's what we are saying. So nobody is defending AstraZeneca vaccine for any reason, but we are saying there are so many factors that can affect these things. It may be genetic, and so on and so forth. In fact, there is even a publication that says it is usually among women who use contraceptives, which makes sense to some extent. So let us know that we should listen to correct people, correct information from correct places. NAFDAC is the institution recognized by Nigeria to approve medicines. If they have approved it, I don't know who you are to disapprove it. We have invested in NAFDAC, government has invested in NAFDAC. NAFDAC has looked at all the issues and they say this vaccine is good to go. So why are you worried? The NAFDAC DG has taken the vaccine. I've taken the vaccine. I'm the experiment, if you're looking for the experiment. And I told you, 25 million people have used this vaccine. So what are you talking about? So at times I don't understand some of these people who are straitjacketed and dogmatic about what they believe. You listen to new information. If there is a new information, we bend to that superior argument. So with that, I want to, and then finally, I talked about herd immunity. And I clearly say there are two ways of acquiring herd immunity. One, by previous infection or by vaccination. Now, people are quoting and saying, how can you say vaccination leads to herd immunity? You are wrong, you are wrong, you are wrong. I say, maybe your ears are blocked. I said clearly, previous infection, vaccination. So, but if you choose to select only one part of the message, so be it for you. Thank you, and God bless you.
Thank you so much, Professor Uzochukwu. To me, ladies and gentlemen, we're actually achieving the purpose for which this program is put up, and it is to look at the information available. I think 2 or 3 days ago, I was listening to the European Minister of Justice for European Union, and they were talking about COVID-19 passport. And the idea will be, how can you force people to have COVID-19 passport? And the man said something that makes sense to me. That there are 3 things that they will request of you if you have to come into Europe. I mean, number 1 is your choice. You want to come to Europe. So if you want to come to Europe, you must be ready to meet whatever the condition the European Union is placing before you. 1 is either you have that passport, but nobody's going to force you to have the passport. Or 2, you can show evidence that you have been infected and you have recovered. And this is what Professor Uzochukwu is referring to now. Or finally, you can show the test result, the PCR test result. Because all they want, if you think COVID does not exist, they know it exists. And they know what is happening to them in Europe there. So let us have an open mind to this. But don't ever forget that our responsibility is to those people who cannot do the analysis that you are doing. I mean, I want us to note that. And that is why the president of the academy, the president of Nigeria felt we need to package this together. Our responsibility is to those people who cannot do the analysis that you are doing now. And we need to give them the right information that can allow them to make an informed decision. At this point, I want to call on Professor Isamate Usaini, who has been present with us since morning. He came in here, he has been on around 9:30, I think, or 9:40. He has listened patiently, he has given us his opening remark. Sir, you have listened to all the comments, and I'm sure you have seen the chat room, We need you to talk to us. Commissioner for Health, Chief of Staff to the Borno State Governor. Thank you, sir.
Thank you. Thank you very much. I think the keynote speaker has done a great job to the topic, and then the discussions also really covered the topics given to them very well. In terms of herbal preparations, as you know, in Nigeria, we have lots of good herbal medications. And in Borno State, we use this Nigella sativa oil with vitamin D3 and aspirin. In fact, we treated, I would say even cured, even in our own isolation centers before even the advent of vaccines. People have taken this in, our doctors, nurses, they were all discharged without even losing one life. The vaccine, especially this AstraZeneca, is the only one available at that time to Nigeria. And as pharmacist Bello said, it's from COVAX, because the Pfizer and Moderna vaccines up till now are not available to most countries, because United States and other countries, they spend so much money and are being used only for their own people. We should have our own vaccine, you know. So, but the Ministry of Health, apart from the 3,900, almost 4 million doses of AstraZeneca, Ministry of Health has ordered more vaccines, even the Johnson & Johnson, according to the minister when we met him in Abuja. So more vaccines are coming, not that the 4 million is the end of it. And already the ministry has already placed an order. In terms of also, one of the reporters said that even though the keynote speaker has addressed it, that why are we producing this vaccine in very short time? This is 21st century. So go and read a little bit about biotechnology, because we can use biotechnology to expedite productions of messenger RNA proteins. And once you have that, it's just putting them in animals, few days, few weeks, you have here what you want to know, the antibodies. So it's not like 19th century or the last century where you wait for 4 years, 5 years, or 14 years. This is the future. Borno State received about 75,510 doses of the AstraZeneca. We have already vaccinated 36,755, and we kept the second dose, and all what we have now left is about 2,000 doses. So, and we campaign for people to take it. Religious leaders have taken it. Our deputy governor, including myself, we took it on TV. We showed people, all the stakeholders, key stakeholders, you know, they took the vaccine. And this vaccine is free. It's free, and nobody is being forced to take it. So anyone who is saying that, oh, someone is pushing for the vaccine and all this, he is just being economical with the truth. So with this, I would say that the vaccine, all the vaccines, actually, if you consider with other vaccines and even some orthodox pharmaceuticals, they are very safe in terms of efficacy. They have very high efficacy. And people made a lot of noise about this clot formation, blood clots. There are ways you can take care of this blood clot. Take baby aspirin, 75 milligram, 81 milligram. As long as platelets are involved, you won't have the clots. So I don't know the big deal about it. And as the guest speaker said, the probability is 0.0004. It's even lower than you being hit by this lightning. So I think we should not be involved in too much politics. We should try to save our people. And 2,000 lives lost, it's not a small number. So if it were your brother or your sister who is dead, one should not be taking this thing as nothing. It is something, and the government should protect its citizens, and vaccination is the way to go. There is very little polio, but still people take polio vaccine. So the way to eliminate COVID-19 is through this route of taking vaccination. Thank you very much. I know the speakers have done a great job. The organizers of this event also did a superb job for the last 4 days. And I'm really proud to be part of the Academy. And I will always participate and help the Academy. Thank you very much.
I like it. Calmly, you have expressed yourself. Although if you check the chat room, you can see that the fire is still raging. but that is okay, like I said before. That's the reason why we are here. I just want to plead once again, either you are a journalist, you are a pharmacist, you are a doctor, because we have so many people here. We have a responsibility to 200 million Nigerians. So please let us temper our opinion, our conviction with this sense of responsibility that everything must be looked around. Yesterday we were arguing on this, and somebody said, yes, planes can fly and drop and kill people in hundreds, but does that mean that we will not fly plane again? And all sorts of things. Whatever it is, you are talking about what is available right now. I think we have been lucky. Maybe one day science will expose why the virus is not as devastating in our environment as it is in Europe and in Asia, in other places. But the truth of the matter is that it is real. And like I said to you, I mean, when you confront the families of those who have lost their dear ones due to COVID, will you be saying all these things? Or should we wait until we start seeing dead bodies on the street before we do something? So these are things that we really need to consider. We don't need to be hysterical about all this. So finally, as we begin to write up, we request that the president of the Nigeria Academy of Pharmacy, Prince Julius Adelusi Adeluyi, to address us and round up the program. Thank you, sir.
Thank you, moderator, and thank you, anchorman, and thank you, all of you who are in the studio for this day's exercise. I want to say that every day the program gathers steam and participation. If you read through some of the points made in the chat room, you will be really well educated as regards the Nigerian attitude. Now, I want us to realize that no one should or could force anybody to take the vaccine. And the flip side is, nobody should or could force anyone not to take the vaccine. So both sides of the river are put into play. I have read some of the views, and I think both sides can be arguably validated. In fact, several people in Nigeria today, not just the elite, the not so elite persons, a great majority of them say Nigeria has too many problems. All these insecurity all over the place. And they say they would prefer food vaccine to COVID-19 vaccine. It might sound funny to some people, but that's the reality on the ground. But the reason, as the anchorman has put to you, we're putting this to you, is that we will be very surprised if a country like Nigeria, that has 200 million approximate people, would all think along the same line. That would be a very boring country. Because when South Africa took a decision to go away from Zeneca to Johnson & Johnson, when people in Dakar said they didn't want the vaccination, same in an area like Punjab, or even some parts of India, were going to take a decision, they had to bring together the views of various people from the various extremes. That is the reason we have this. I believe that what we've been doing in the last few days, and we will do for the next 2 days, is to expose everybody to the opportunity of saying whatever you have said today on the chat platform. But I can tell you that at this stage, when it comes to COVID, you have to be circumspect about it. People in Brazil who lost 3,800 people yesterday to COVID, the rate of loss being only second to the US. Don't argue anymore as to what to do to save lives, because their cemeteries are overflowing. Of course, some Nigerians have said we don't have people dying along the streets, so why should we worry? It is because Nigerians at this point in time have basic existential problems. Even staying alive is a full-time job in Nigeria. So COVID may not be the priority concern. However, COVID is real, and as you have been told, you are not forced. So this program is not supposed to persuade you. It's supposed to educate you so that you can take an individual decision as to whether you want to take that or not. Me, as the Emir said, I've taken my own jab because of the information I have. One day, the true and full story of COVID will be told. That's one day. But now, you have to stay alive. And you need knowledge to be able to know what decision to take. Now, I believe, like many, that it's better to have knowledge about a situation than to be driven by fear, rumors, and conspiracy theories. The chat room, for example, says malaria kills 300,000 people a year in Nigeria, and COVID doesn't. So what makes malaria inferior to COVID? Why is COVID pandemic? Now, all you needed to do was just check the meaning of pandemic in just Google it, and you'll find it an ailment qualifies to be pandemic if it simultaneously affects the well-being of people in many nations of the world and goes across borders. At the moment, COVID is all over the world, in over 142 countries. And everybody is coping with it. Anybody who reads newspapers or listens to news, we know that it's a plague that affects people across the world. So that's where the word pandemic is, because it's pan over the world. Whereas it can be an endemic ailment, like malaria, but it is confined to a certain area of the world, like malaria. So no matter how many people it kills, if it's not pandemic, the people who are expected to take care of themselves vis-a-vis malaria will be those in that particular country or those countries. But take West Africa. Malaria has been with us forever. What are the researchers doing? Don't blame researchers. How well funded are they? We discussed this yesterday, and I hope some of you were there. So what we have done is to try to assemble experts to address this issue of COVID and the attitude of people to it. Tomorrow we're going to be talking of the regulatory bodies like NAFDAC And on Saturday, we're going to be talking of lessons learned. So those of you who feel very strongly should come to strongly express your views. And you will be given the opportunity to talk about lessons learned. If you come tomorrow too and you have problems with the regulatory bodies, no problems. Today, the Emir has spoken. And other people who are non-Emirs have spoken. And what makes this valuable as an exercise is that we do have views that are pro or contra. Let's encourage that. That's what the academy stands for. So some people are observing even on the chat table that, oh, yes, you people are always saying the same thing since you started. Maybe you were given some money by federal government. Federal government that is printing 60 billion to satisfy some states. Absolutely. I think it's just ludicrous for anybody to think that anybody is being paid to go through this exercise. Remember that we're here to expose everybody who is participating to the science of this particular ailment. And therefore, you can take your reference point from whatever has been said. And I hope somebody is also watching what they're saying in reaction to what I'm saying on the chat room. Now, it remains for me to be able to thank, to appreciate some of the best brains we have brought. Look at the chairman of this occasion, Professor Isa Marte Husseini. He's a professor of pharmacology. Some people may not have gone to school at all and still have views which may be valid, but if you took the trouble of going to school and becoming a professor, the assumption is made in your favor that you have a bit of knowledge. He is a professor of pharmacology, and he specializes in the study of herbs, especially for cancer therapy. He is one of those professors who feel, why should everything be done outside? Why can't we do local research and go on? You can't be better informed than that. Of course, he's from Maiduguri. He's a commissioner for health and is the chief of staff to the governor of the place. He's an abusite. An abusite is somebody who has qualified from Ahmadu Bello University, and they always assume that every abusite is naturally ahead. Mr. Chairman, we are proud of you, and we are not surprised the way you have addressed your role as chairman today. You filled the whole chair. May you continue to make us proud. And then, of course, we have Professor Ike Uzochukwu of UNIZIK. I don't know how the organizers got him, but here is a young man whose only way is upwards. By the way, Professor Uzochukwu, please make sure that everybody has a share of your presentation. It's been wonderful. It's some people are saying, of course, you say the research. Some people are saying that the research you say is from you. When the chat room somebody says it's a research, they are not facts. Some people even go as far as saying you're a coconut head professor. But you see, you cannot be in Nigeria and not be exposed to vicissitudes, right? So, Professor Coconut Head, just take it easy. We are very proud of you. That's what makes this program very interesting. Professor, you are a professor of bioinformatics. So you have loads of information. You are a professor of genomics. You are a professor of molecular modeling and computational chemistry. Now, if anybody then continues to criticize you, don't be upset. Explain to them, because many of us Nigerians need to be educated. I need to be educated. The work you're doing, all I can say to you, Professor, is that we should be in touch. You've just spoken to a very small group now, But we must work it out so that we can give you a place to stand so you can move the world. And it's going to happen. And then, of course, we have a panel of this discussion people managed by Professor Mbang Femi Oyewo. Here is a Professor Mbang who does everything with a bang. She has been president, she's been chairman of the Board of Fellows, and has been banking a lot of progress into that particular body. And we are proud of her. But apart from banking, she is a verified professor of pharmaceutics and pharmaceutical technology. And I believe that here is a lady who, though she claims to be 70, has the energy of a 40-year-old girl. Not just the energy, but also the beauty. But we wish you well. I was many years ago, when I read your work on the suspending properties of Abasia zygia on sulfonamides, anybody who reads that will know that you meant to go well up the ladder. And here today you are. You have been, you are a pride to yourself, you are a pride to pharmacy, you are a pride to motherhood. And I hope that Soji is here to hear all this we are saying about your mother. To fit into her shoes, you got to work hard, Soji. This is basically an opportunity for a robust intellectual interface. And this has been supported by the panelists. Ekanem, you've spoken so well, with such confidence. Where did you get that confidence from? But not only confident, but also fact-laden. It's full of facts, fact-laden presentation. We appreciate you. Dr. Zango,
Thank you.
You have made us proud, Dr. Zango. You've reached that height in the NNPC. Now, when you were introduced as the group managing director of NNPC, I was quite happy. It's a very profitable error. But then they went ahead to correct it. But it doesn't matter, Dr. Zango. You are our own GMD of NNPC.
Thank you, sir. Thank you,
and
sir.
Pharmacist Sunny Bello, you also went through with all those very quiet presentations. But you know what? We really appreciate you for bringing the Emir with you. And we have been educated by the Emir. So generally speaking, today has been surprisingly more active, more educating than we had budgeted. Now, I believe that all those who have opposing views, no matter how acidic, should do their homework. So that on Saturday, when we have these lessons learned, give us information ahead of time that you want to make some comments. That is the only way where we can make some progress. The Pharmacy Academy has all the content from research, from these aforementioned people. But that's why we went into partnership with the Nigerian Guild of Editors. They can do the advocacy better than ourselves because it's their duty. They can do the advocacy. We will provide the content to make that content better. Those who are opposed or those who have contrary views must, like the iReporter man, is it iReport? The iReport man did, and some of the others, say it boldly. It is better to say it boldly than to whisper it in the background. If you love a girl, for example, and you are smiling at her in the dark, she doesn't know whether you love or dislike her. So don't do it in the dark. Come straight to us. If you want us to have a discussion on food vaccines or some other things, if you want us to make sure that some of these countries have condemned the things, let's find the facts together. Nigeria has to move forward, not on rumors, but on certified facts. I thank you for coming. I thank those who have supported. I thank those who have opposed the, it's like a debate. And somebody who says that we must have a robust intellectual debate, this is the beginning. Prepare to participate in the future. Again, I thank you, all those of you who are here on ground, and all those of you who are, at this point in time, over 90 of you left, for participating. May the God of pharmacy assist us to work for a better Nigeria. Thank you.
Amen.
Thank you very much, sir. I think you've nailed it. No matter how acidic the comments are, we have the base to apply on it and possibly neutralize and let us have a better option. Yeah, at this point I will call on Sir Ivanyi Atoyi to give the vote of thanks. But before we do that, we have some plaques to present. Can you bring this for me? I will ask Sir Atoyi to present it and give the vote of thanks after.
Well, we have some plaques to present to those who have made us proud today. And if you can take it directly from me, I will appreciate it. So I call them in no special order. Well, the order is the way they were passed. So I have Dr. M.M. Zango. Can you take it? If not, just stretch your hand and take it.
You can send it online.
Just stretch.
Stretch out your hand. Yeah.
And I have one for Professor. Mba, Mba. What do you say? Mba.
Thank you, sir. Thank you very much, sir. It's genuine.
And then this one, without label, so it has label. Seeing is believing. Yes.
Pharmaceutically packaged. Push it.
Okay.
Just push slightly.
Very good. This one is special because it is for Commissioner for Health for the state. Professor Isamate Hussein, who is our chairman for today.
Thank you.
Well, let me just thank people for today. We have extended our time, but it has been well spent. You all agree. And I must appreciate standing on what the president has done. He has done the vote of thanks, but I cannot help mentioning Professor Issa Mate Hussein again, the Professor Ike Uzochukwu, and our professor here, Femi Oyewo. She is here physically. Thank you very much. I'm happy that we had a lot of participants today, and we are nearly 120. Tomorrow will be better. Some have left, but I want to still mention and encourage you to be with us tomorrow. We have Professor Emma Ibezim, he has been around, Professor Dave Ifudu, Dr. Mayo Adejumo, Dr. Dokas Omeire. They were all here, some are still here. Dr. Saidu Muhammad, Mr. Sonny Bello, Sir Paul Enebeli, pharmacist Ngozi Okoronkwo, Dr. Margaret Obono, pharmacist Kola Shodipo, Dr. John Wiwu, Ijoma Oke Ewurm, the PR for pharmacy, PSN, Ignatius Anuku, who is our IG, Inspector General of Police. And yes, and some others, I can't mention all the names because we are under pressure of time. Please come along tomorrow, but I must appreciate the panelists themselves. They have done well today. Mbabasi, is it? Nsabasi. Mohammed and Sonny Bello. Yes, they have done well today. Thank you very much. Those I haven't seen and those I cannot mention, I pray that you will be with us tomorrow because the event will carry on till Saturday. Magibru. Oh, I saw one Hebrew. Oh, I saw Miss Magibru. Okay. Oh, yes. Maggie is here. Thank you very much. I expect all of you tomorrow. May God bless us all.
Amen.
Thank you very much. You see, if you go into the chat room now, you will see it's more or less like a church gathering. So many hallelujah there now. In fact, my good friends there, they have given the president of the academy, they have given him another title. He's now a professor. So you are now a professor. So it is very good. So people already, Biodro Fasimi is already responding with hallelujah, and that's a good one. Now, tomorrow is power part. We're going to have the president of the Pharmaceutical Society of Nigeria, Mazi Sam Oabua, as the chairman of the day. We're going to have Professor Mujisola Adeyeye as the keynote speaker. And we're going to have the Registrar of Pharmacists Council of Nigeria, the Registrar of Medical and Dental Council of Nigeria, the Registrar of the Medical Laboratory Council, Medical Laboratory Science Council, and the Registrar of Nursing and Midwifery Council. Then the WHO representative, Hamsa Tomatayo. We are going to have them here. They are going to discuss. And this is why I want to say that the purpose of this is to create a platform where you can ask questions, you can express your opinion. But please, you have an opinion. Please respect the fact that the other man too has an opinion. So what is important that we put the two together and decide which one is the best. Thank you very much for coming. God bless you. See you tomorrow. For those who are asking for their own plaques, don't worry. Your time will come. Just relax. Calm down. Thank you. God bless you. We hand it up with a prayer. I was going to do that for us now. Yeah. Do we have a volunteer up there? Okay. I cited Moses Oluwalade.
I can volunteer.
Okay, who is that? Yes, unmute
Yes,
yourself.
Biodun Fasemi.
Oh, Biodun, okay, I heard you shout hallelujah. So go ahead and pray for us.
Yes. Oh, thank you very much. Okay, our dear Heavenly Father, we thank you for this meeting. We thank you because the reason why we are gathered here is for the truth to prevail. And not just for the truth to prevail, but for the safety of everyone in Nigeria to live in good health and also to prosper in their bodies. And Father, we pray that as we gather for these collaborative meetings, where we can learn and come to a consensus on the truth of what is really going on in Nigeria, the realities of COVID and the vaccine. We pray that your will be done in Jesus' name. And in Jesus' name we have prayed. Somebody say amen.
Amen. That is almost
Amen.
another keynote address, but okay.
See you tomorrow.
Biodu, make sure you are here tomorrow.
I'll be here tomorrow.
I can put you on the spot. Come to the studio. I want to see you.
Send me the address.
Come to the studio.
Okay, well
thank
done,
you.
moderator. Well done,
God
everybody.
Bless you all.
Well
Thank
done,
you.
everybody.
We see us Have a nice day. See you tomorrow. See you tomorrow. Thank you. God bless you all. God bless you.
Bye.